Let's talk about scorpion bite today. So two main scorpions are found in India, which are poisonous. One being the red scorpion and the black scorpion. Now, majorly, the scorpion produces local manifestation and systemic manifestations. So, local pain, basically, local manifestations are local pain which will radiate along the corresponding dermatome. There will be edema, there will be urticaria, there will be fasciculation and spasm of the underlying muscles at the site of sting due to persistent stimulation of pain. Conducting receptors and liberated serotonin. Sudden tap at the site of sting induces severe pain and sudden withdrawal of the part called as tap sign. Now coming to systemic manifestations of the scorpion bite. The red scorpion venom is a potent sodium channel activator and stimulates the autonomic nervous system, resulting in sudden pouring of catecholamines in the circulation. So both the sympathetic and parasympathetic system are activated, will lead to something known as autonomic storm, which is characterized by initial parasympathetic stimulation clinically detected in the form of vomiting once or twice, profuse sweating all over the body, ropey salivation. The word ropey is very important. Ropey salivation, priapism, which is characteristically found in scorpion bite, mydriasis, bradycardia, hypotension, and transient PVCs. After the parasympathetic activation, there is sympathetic stimulation characterized by propped eyes, puffy anxious facies, oculogyric crisis, chest discomfort, perioral paresthesias at the times of tingling and numbness all over the body, and cool extremities. So the scorpion bite or the scorpion venom will cause autonomic storm. It will first activate the parasympathetic system. Later, the sympathetic system will be activated. Pulmonary edema occurs in around 30% cases of severe scorpion sting bites with respiratory failure. It develops within 30 minutes to maximum period of 36 hours. Now, clinically, pulmonary edema can be suspected when the respiratory rate is more than 24 per minute, orthopnea, intractable cough, low volume, fast thready pulse, narrow pulse pressure, summation gallops, systolic murmur, and moist basal rales, and central cyanosis. After 20 to 30 hours of recovery from the autonomic storm, the victim develops asymptomatic warm extremities accompanied with bradycardia, hypotension, and prolonged QTC interval on ECG. So coming to the scorpion sting, it consists of 5 stages. Stage 1, which is from 0 to 4 hours. Stage 2, which is from 4 to 6 hours. Stage 3, which is from 6 to 10 hours. Stage 4, again 0 to 6 hours. And stage 5, which is beyond 12 hours. Now in stage 1, patient presents with sweating, salivation, mydriasis, priapism, hypertension, hypotension, and cold extremities. For such a case, you start ASV plus prazosin. ASV is anti-scorpion venom and not snake venom. Okay. Now, stage 2, patient comes with hypertension, tachycardia, and cold extremities. You will again start with prazosin and anti-scorpion venom. Now, in stage 3, when patient presents with tachycardia, hypotension, pulmonary edema, and cold extremities, you will start along with prazosin. When the patient has pulmonary edema with hypotension, you will start with an inotrope, that is dobutamine, anti-scorpion venom as usual, followed by, for pulmonary edema, you will start NIV and mechanical ventilation. NIV is non-invasive ventilation.